Today, New Zealand's total number of new cases has increased by 6. These are all confirmed cases. 3 are associated with overseas travel. These were people who came back, who were repatriated from the Greg Mortimer cruise ship, and the other 3 are related to existing clusters. The new combined total of confirmed and probable cases in New Zealand is therefore 1,451. Sadly, today I am reporting the death of a woman in her 80s who was one of the residents of Rosewood Aged Residential Care Facility who had been transferred to Burwood Hospital. The woman had underlying health conditions. As I've previously outlined, due to the vulnerabilities of people in this group, some have not been tested for Covid-19 and instead have been managed as probable cases, and the woman who has just passed was one of those cases. Every person we lose to Covid-19 is a tragedy, and with family and friends left without their loved one, and my thoughts and those of others I'm sure are with this woman's family today and in coming days. There are now 1,036 people who have reported as recovered from Covid-19. Today in hospital we have 11 people. 2 of these are in intensive care, 1 in Middlemore and 1 in Dunedin Hospital. They are both reported as being in a stable condition. We still have the 16 significant clusters, and 5 more Covid-19 cases have been linked to clusters. Some of those were cases that were under investigation and have now been associated with clusters. I am pleased to report our labs yesterday processed a record number of tests for a single day. That was 5,289 tests. It brings the total number to 94,797. And we have in stock today testing for over 87,000 tests. Around hospital visits, and there's a lot of interest in this, which I can understand, particularly as we move from Alert Level 4 to Alert Level 3. Clearly, the restrictions on visiting people in hospital do create hardships for both family and those in hospitals. We are working on the visitor policy and how it will look under Alert Level 3. And just to acknowledge, while this may seem a relatively simple thing on the face of it, along with all the work we're doing with district health boards, it's how we do as much care and deliver as much care as possible to people under Alert Level 3 while keeping patients, staff and visitors safe. So that work is ongoing, and I will update you on it as soon as it is finished. There is wider testing across a range of communities today, with a particular focus on ensuring we reach Māori and Pacific communities. In Northland, there is increasing testing in conjunction with Māori health providers, and they will be providing mobile testing facilities going out into smaller communities. This provides those with an opportunity to be tested, those who are there, as well as general health and wellbeing checks and flu vaccinations. So clinics will be available this week in the far north, Kaitaia, Hokianga, Kaikohe, Kawakawa, Mōrewa, Kaipara and Kaiole. There's also a drive-through clinic in both Kerikeri and Whangarei. Taranaki DHB is continuing community testing of people with symptoms and encouraging anyone with symptoms to get tested. They're working with their Māori health provider network to help set up and deliver a range of outreach options to take testing closer to home. And in conjunction with Ngā Ruahine, Ngāti Ruanui and Tui Ora Māori health providers, there will be community-based outreach clinics in both North and South Taranaki. And this week around the country there will be testing of selected groups, including health workers and essential workers, as part of our community-based testing, just again as part of our surveillance to ensure that we are not missing any undetected cases of Covid-19 out there. And just finally on testing, the CBACs, or Community-Based Assessment Centres, are for people who are symptomatic, either referred by Healthline or a general practitioner, or if someone does have symptoms. They are not there to test people who are asymptomatic, and you do not need a test if you're asymptomatic before going back to work next week.
I just want to pick up on Dr. Bloomfield's reference to the fact that there were 3 cases today amongst our confirmed cases who were connected to overseas travel. And this is just an opportunity for me to highlight again that regardless of moving to Alert Level 3, New Zealanders who are returning home will continue to be quarantined and isolated in government facilities at Alert Level 3. That will continue on. We have given no endpoint to that part of our response to COVID. It is an intrinsic part of our response, and it is not changing because we are moving alert levels. To give you an update on numbers, we currently have 2,403 people in government-provided facilities, essentially hotels. The number in quarantine, so those who we are testing or who have symptoms, is 97, with the remainder being in isolation, but again in those hotels. I want to make that clear in case there was any confusion amongst the public over whether that would change. It will not. In terms of government news more broadly, you will have heard and seen that we are preparing, as Dr. Bloomfield pointed out, to transition New Zealand to Alert Level 3 next week. Level 3 information has been shared, and many of you have been here for that process, and it's continuing to be updated and communicated as there were some smaller pieces of work that we needed further advice on. Schools and businesses are preparing as we speak for that move from next Tuesday as well. Safety, of course, remains paramount, and I know that's top of mind for employers and workplaces as they make the necessary preparations to have their teams who cannot work from home re-enter the workforce. On the larger end of this scale, New Zealand's largest infrastructure project, the Auckland's City Rail Link, will be back to work post-lockdown to help support jobs in the construction sector. 200 workers will resume construction works on Tuesday at CRL sites at Britomart, Lower Queen Street, Albert Street, Aotea, Karangahipi Road, Mount Eden, and on the southern line at Otahuhu. And this will ramp up to pre-pandemic workforce, which was 400 over the week that then follows. We've worked really hard to cushion the blow from COVID-19 with initiatives like the wage subsidy and advance payments to transport contractors, but getting transport infrastructure projects back underway safely is part of our transition out of Level 4. Of course, measures appropriate for Level 3 are being put in place, including restricting access to sites, having workers maintain physical distancing and providing protective clothing where that is necessary. Waka Kotahi, New Zealand Transport Agency projects and non-essential state highway maintenance will also be able to resume under Level 3 as well, but with strict health and safety protocols. NZTA is working with contractors on specific COVID-19 plans for each project to keep workers and the public safe. In the meantime, as you'll hear me continually repeat, New Zealand is still at Alert Level 4. While I know there will be things we're all looking forward to under Alert Level 3, we must not risk the gains that we have made or that many New Zealanders have made sacrifices for over the last 4 weeks. Police have told me that while 99.9% of us are respecting the measures put in place, there are still some who are choosing to flout the rules, and I have the numbers on that for you. As at 6 p.m. yesterday, there had been 4,128 breaches of the CDM and Health Acts, 433 prosecutions, 3,580 official warnings, 115 youth referrals. More than 5,600 reassurance patrols at essential businesses and crime prevention patrols in neighbourhoods and business districts have been carried out in just the past 2 days. Each and every one of these people involved in breaches risks undoing the work of others. So again, I say, please do not travel unnecessarily or gather. Police will be conducting checkpoints and they will be enforcing the rules, and they do that to keep all of us safe. Finally, you may recall that on Monday I mentioned that some workplaces, as they prepare for the return into workplaces that they need to return to, will be using these next few days to prepare. That includes premises being cleaned in preparation as well. So today, my thanks and appreciation goes to our cleaners, and not before time. I've had many letters during our lockdown outlining their essential work during Alert Level 4, such as from another essential business, a meat processor, crediting their cleaners as a core part of their success in continuing to move products around the country for New Zealanders. from our courts who say their cleaning staff are the first line of defence in keeping our courts safe, often working extra shifts at all times of the day and night. And even Rose, a cleaner at Otahuhu Police Station, who currently works 13-hour days. These are our essential workers, and I hope we continue to recognise them as that long after this pandemic has passed. Thank you for keeping us safe.